Hello, I'm James Currie with the Communications Department here at MCHD, and we've got a special Wellness Wednesday today. We're talking to Brad Phillips. He is the Director of Inspection Services, and yes, he's with me at a remote location. And the reason why we're talking to Brad is it's so atypical right now for all of business that we're doing, right, Brad?
Yeah, it's definitely a different environment for us. We're learning and adapting and doing new things every day.
Yeah, that's what I was thinking, from the coronavirus. Normally your inspectors would be going out to restaurants on a regular basis, and it's just kind of business as normal. And, people are already contacting us about setting up for Mardi Gras and all that kind of stuff. So there's a lot of unknowns. Um, so can you kind of go into a little bit as to now the business has changed? What exactly are the inspectors doing right now during coronavirus?
Well, I've got about half my staff that are actually doing contact tracing while still trying to do some inspections. The rest of the staff is kind of doing business as normal. We're not out as often in every place, but we are going out and doing routine inspections. We're doing a lot of new business opening inspections. And we're doing a lot of complaint investigation. Some of the complaints are COVID related, some are food related. Uh, we've got our IS complaints email address that people are sending things into, and anything we get on that, we do go out and check into and try to verify or see if we can do something to resolve that situation.
So you can be called the food police.
Partly, yes, yes.
Yeah, I know that you all are receiving a lot of information. Dr. Randy Murphy has alluded to some of the numbers of the complaints that you all have been receiving. And is it, is it one central kind of overarching thing that your inspectors are seeing over and over and over again?
A lot of it's the mask complaints, people not wearing masks in the restaurants and some of the other locations, if it's a retail store, something like that. Um, and we get a lot of folks not wearing gloves. And part of it is that we have some enforcement authority over restaurants themselves for the use of masks for the employees that have direct interaction with customers. But for the customers themselves, we don't really have any control over that. That portion of the order is an individual mandate, and we can't enforce it on the individual. We can do it on the business, but the business isn't responsible for making sure their customers are wearing a mask when they come in a restaurant.
Mm-hmm. I know that a lot of the restaurants are also operating at a diminished capacity right now too. So is that something that you're helping advise them with?
We've advised, we're not seeing too many issues on that. Occasionally we'll have a situation that will come up, but for the most part, they are social distancing. They have the tables spread out. I know we hear a lot of things that they're at half capacity or 35% capacity. The order didn't really include that for food establishments. That was on retail establishments. So the food establishments just have to maintain the social distancing between the patrons.
You alluded a little bit to the amended safer at home order. Can you kind of say reach out through the internet right now and speak to all of the people in the restaurant to remind them what parts of that order pertain to them?
Yes, it's section 19, and that involves restaurants, bars, any food service establishment. That section is in effect until the end of August, at which time we'll either see it amended, rescinded, or possibly extended. I say it's the ended, because we've got so many possibilities. We never know what's the governor or Dr. Harris will do with that, but they've been pretty good at updating it and getting it out there before the end deadline. But we don't know what's going to be in that order when it changes, if something's going to change.
What about a reminder? I know that you're getting a lot of notices from the public where they say, oh, there's a person in the restaurant and they're not wearing a mask or gloves. Can you kind of summarize where they should be wearing masks and gloves? Because I know there are some parts of a restaurant where it's okay that they don't need to wear those.
Yeah, so the back of house staff, as we say, anybody working back in the kitchen, in the dish room, anywhere like that, they're not required to wear masks or facial coverings. Anybody who's up in the front counter area or who has waiting on tables or has direct interaction with that customer, whether it's a drive-through window, a cashier, a server, they're all required to have facial coverings on when they're doing those interactions. So they're the key folks there that are covered under that order.
Let me get my mask here. So
Mine
I
too.
see this quite a bit.
Yep. Nope. Nope.
This perfectly okay, or
No,
you
because the way the order reads is supposed to fully cover the nose and the mouth. So yeah, having it drop down below the nose, that isn't really going to be effective. You got to think that that mask is to really help protect other people from yourself in case you were an asymptomatic carrier. Uh, you got to think you sneeze, if your nose is uncovered, stuff's going to come out. And
yeah,
where's it going to go? So that's need to cover the nose and the mouth.
absolutely. Yeah, that was just a little skit there. We already knew what the right thing to do was. A couple of things I wanted to touch on too. I know that you all are still doing inspections. In case the public didn't know, they can go to mchd.org, go to the drop down up top to restaurant ratings. They can see the current inspection scores for this current week. Plus, they can also do an expanded search if they want to look back and see some historical information from some of their favorite restaurants as they've been scoring their inspections, correct?
Correct. So that's available there for the public to use, and we feel that that's good information for them to have and be able to look back on.
Any rumors you want to dispel right now about uh, food service during coronavirus, things that you've heard?
Yeah, all the information coming out of CDC and the FDA, everything seems to indicate that there's no transmission from the food itself. If somebody prepares something and you eat it, you're not going to get coronavirus. The problem is the surfaces, so the common touch surfaces. So it could be the packaging of it, but the food itself is going to be fine.
All right, so that's a good thing for people to know that in order to keep the economy moving, maybe select a day during the week where that's your takeout night, to help support a restaurant. A lot of businesses are having it kind of rough right now. Lastly, I know you all also advise all of the school systems in Mobile County, some of the public and private schools. So if you're a business owner um, at a regular establishment or a restaurant, please pass along the information as to how people can get in touch with you all to get some advice or guidance.
Okay. They can call our office directly at 251-690-8116, or they can actually, if it's a complaint issue, they can go to iscomplaints@mchd.org. That's iscomplaints, complaints with an S on the end, at mchd.org.
Okay. Well, Brad, thanks a lot for just giving us an update of what's going on, and it is a public health concern right now, and it is it's a Wellness Wednesday topic that we have been wanting to address a lot right now. They're just been kind of fearful about eating out in a restaurant or doing takeout, and you know has the health department stopped checking these places and all this kind of stuff. So we know none of that is true. So, well, thanks again, Brad. And anything else you want to add?
Yeah, there's one thing that came out last week. It's kind of some new information. As you know, the state, when they amend the order's there and it's kind of open to some interpretation. Well, that's up to the state attorney general's office. And last week they gave some clarification. which is on the self-service drink fountains. So originally, since we went into opening restaurants back up and they were allowed to serve, the self-service facilities were excluded. So buffets, the condiments that are common source condiments, or self-serve drink fountains. And that had been in place up until last week, when they rethought the situation, and based on the data, they said they had people coming up with creative ways so that they had employees actually serving customers from the drink stations. They said it was creating more problem than it was helping. So they've opened it back up to where people can use the self-service drink stations. It's restricted to a disposable cup in one fill. They can't sit at the fountain and try this flavor and then try the other flavor and let me dump that out and get a different one. It's one fill, drink and discard, but it is allowed now.
Thank you for clarifying that. We've had a lot of people contact us about a lot of those self-service drink stations are not necessarily in restaurants; they're also in gas stations and other places like that too. So thanks for that clarification.
Yeah, and people don't need to be bring in their big plastic cup and refill it and try to bring it back and refill it again. It's a one shot deal there.
I appreciate that, Brad, and thanks again for your time and giving us this update. And I just want to let you know I'm James Currie here with the Communications Department, and I've just been speaking with Brad for this special edition of Wellness Wednesday. Thanks a lot, and we'll see you next week.
Thanks, James.
Yes, sir.